Welcome everyone to the webinar. I'm delighted to have you here. As you roll in, we're going to launch a poll here. This poll is just to ask if you're an interpreter, a healthcare services administrator, or any kind of administrator, or a healthcare provider. I am Marjorie Bancroft, the founder and director of Cross-Cultural Communications. So I'm your host today, but I'll be disappearing shortly to make way for our wonderful presenter, Daniel Sanchez. And I have a particular delight in welcoming him to this webinar because Daniel has actually been a trainer and a wonderful trainer at that for our STAR program, the community interpreter. He has ventured in all the way to Maryland to teach for us. I'm going to allow Daniel to introduce himself, but I want to tell you that he has an impressive career, not only from the interpreting side and the interpreter trainer side, but working with language companies and healthcare, directly in healthcare. So in many capacities, including the subject of this actual webinar. So I am not going to take up too much of his time. But I do want to direct your attention to the Q&A feature, which is where we would ask you to put your questions for Danielle at any time throughout the first 45 minutes of the webinar, so that we can ask him these questions toward the end of the webinar. However, to say hi or chat or ask questions of us behind the scenes, including Andrew Hall, who will be assisting with the webinar as I will be behind the scenes, could you put those questions into chat? Also, you may want to notice that if you want to direct your chat to everyone as opposed to just us panelists behind the scenes, you'll have to change your settings to panelists and all for your message to go out to everyone. So without further ado, this is our first webinar that directly addresses a topic that's very dear to our hearts. We're really delighted that Daniel agreed to speak about this, which is diversity, equity, and inclusion. We had no idea about how timely that was going to be today of all days. I was there at the live announcement last night, as many of you were, for that important Minnesota case. And so here we are the next morning when the whole country is really thinking about these issues and grappling with them. And I am pleased you will hear when Daniel introduces himself how lucky we are to have him speaking with us today. So without further ado, I'm going to hand it over to him. You will see me later at the end of the webinar, but meantime, thank you again, Danielle, and have a wonderful time with our audience. Oh, and I should end the poll now because almost 300, more than 300 have answered. And I'm sharing the results so that you can see that your big audience there is almost entirely 94% interpreters. And but we do have administrators and 5 healthcare providers as well. Welcome to all of you and thank you.
Excellent. So thank you, Marjorie, for that introduction and your kind words. I will share a little bit of my background with the participants. I've spent about the last 15 years in language access and diversity, equity, and inclusion. I am certified by the National Board of Certification for Medical Interpreters as a Spanish-English interpreter, licensed trainer for TCI, and also a host of TCI Online, licensed DEI practitioner through Cornell University. I've been an assistant administrator of the Leadership Council at the American Translators Association, member of IMEA, the International Medical Interpreters Association, the National Diversity Council, and the National Association of Latino Healthcare Executives. So both topics, as it pertains to both diversity, equity, and inclusion, and language access, is very near and dear to me. And I look forward to presenting the information and answering any questions you may have. So let me go ahead and share my screen with you all. And just let me know when you can see that. Andrew or Marjorie, are you able to see
So
that?
I had to unmute. I'm so sorry. We see the presenter view.
Apologies.
Not to worry. Take your time. There we go.
Okay, excellent.
You got it.
Okay, so that's a little bit about who I am. So during this webinar, we will be focusing on some key areas. One is understanding the nuances between what a traditional VRI session looks like and what a virtual health encounter looks like from the interpreter view. We're going to review and reinforce some of the things that you learn as interpreters through professional interpreter training, which are your introductions, managing the flow of the conversation, and adhering to your code of ethics. And lastly, we'll identify some best practices and develop strategies to navigate these virtual health encounters and ensure a positive experience for your patients and for the providers you are assisting. I will say that the tips and best practices also include some recommendations for providers as well. So thank the 5 of you who joined today, and those interpreters who work closely with providers, feel free to share the information with the providers you work with at a local level as well. So first, we'll dive into a little bit about what DEI, diversity, equity, and inclusion, and health equity have to do with virtual care. Okay. So first is COVID-19. COVID-19 really forced a rapid expansion of virtual care, but it did so without equitable access. And so historically marginalized and underserved communities were and continue to be severely impacted by the pandemic and the lack of access of information to proper care. We see on the news and in our communities how people who are limited English proficient or those who are deaf and hard of hearing have a hard time accessing care for COVID-19 or even vaccine distribution. The next is telehealth platforms without language services. The truth is that telehealth platforms simply were not designed with language services in mind. And so they often overlook vulnerable populations, such as the LEP and deaf and hard of hearing community. We also have diversity, equity, and inclusion healthcare initiatives. So just based on the social justice issues that have really rocked our nation in addition to the pandemic, these issues have really highlighted the disparities that existed all along and were perpetuated by the pandemic. And so among these are healthcare disparities, which are a direct result of social determinants of health and access to quality care. So what does that mean? That means that with DEI initiatives across the country, there's been an added pressure on these health systems and communities to do their part and ensure that virtual care programs are inclusive of all patients, especially those who are most vulnerable. Lastly, the law. There is legal precedent in the marketplace that failure to provide language services, which may have avoided a poor outcome, has resulted in significant penalties and fines for healthcare venues. So all this to say that the shift to a digital healthcare landscape must take into consideration the limited English proficient population and then deaf and hard of hearing. But it's not only because it's the law, it's also because it's the right thing to do to be able to meet the need for all the patients. So how does it work? There are multiple ways in which you can connect. First is the audio connection. So you can invite a guest with a phone number. Many of the platforms have that feature. Typically, audio is rated poorly among providers and patients alike. And the audio feature does not meet all of the regulatory requirements. So as it pertains to the next section, video, there are multiple ways you can invite an interpreter or a guest, one of which is email, and the other is a SIP room system. So there's what's called SIP calling, which is a technology used on some of the telehealth platforms to be able to queue in an interpreter into a virtual health session. There are also other ways where you connect virtually, such as bedside media, patient engagement applications, and electronic medical records or electronic health record solutions as well. So where the providers are doing their charting is also capable of launching a video session and queuing an interpreter to join that session. So some of the important things to note is that this is really two separate video systems attempting to communicate. There has to be a perfect handshake that happens between the interpreter's technology and the telehealth platform. And so because it has to be perfect each time, and we know as stable as technology is, there will always be an issue here or there. We need to recognize that technical issues will occur. Second is that telehealth platforms are handling calls outside of the United States at times. And so this could impact the way that the language service provider is joining the session. So it's just important to note and make sure that we advise providers and language service administrators that the call handling from the telehealth platform is really outside of the language service provider's control. So when we look at things like long wait times or dropped calls, it really does need to be a partnership between the telehealth platform and the language service provider to be able to provide the best service for the health venue. I'd be remiss not to mention that there is one telehealth platform that does offer language services natively integrated, and this is Cloudbreak Health with Marty by Cloudbreak. So Cloudbreak Health is a healthcare disparities company. They offer unified telemedicine solutions, one of which is language services. And their telehealth platform has the interpreter services built into the platform. So it isn't like these other services where you're adding an interpreter into the session from an external source or a third party. It all happens internally. So just something to share with your systems as well. So a question for those who are attending this webinar before we get into the content on this slide is, what are your thoughts or what do you think the difference is between a traditional VRI session for the interpreter and a virtual visit? I'll give it another minute or so. Okay, so there's been a question to repeat the question, and the question is, what is the difference for interpreters from a traditional VRI session and a virtual visit session? So we have some answers here about not in the same location. The virtual visit interpreter doesn't have to be in video, and some others who are unsure. Great, so we will dive into that information now. So typically on a traditional VRI session, you're right, providers and patients are in the same location and the interpreter is remote. So as you'll see in the graphic above, you'll have the interpreter on the screen and you'll see the provider is bedside with the patient. We also have the fact that providers will be easily identifiable by their attire or their employee ID badge. And you will see that typically, as you can see in the graphic above, the device is positioned in such a way where the interpreter only sees the patient. Okay. With a virtual visit session, all parties are remote. So the patient and provider typically aren't not in the same location. Providers may be at a clinic, may not be at a clinic or a hospital, and a patient's location will vary. So some important information here is that providers may call in from their home office. They may be in a more business casual clothing, right? So they're not as easily identifiable. They won't be wearing a lab coat or scrubs for the most part. And also, in case you haven't noticed, people in healthcare love to have a bookshelf or art or maps in their background. So their backgrounds may look a little bit different. So just keep these things in mind. The reason why it's important that we know that the patient's location will vary is because patients now have the ability to join from virtually anywhere. And so where they have an internet connection is where they'll be joining from. And what we know is that many limited English proficient patients simply don't have access to a stable Wi-Fi connection at home or access to the appropriate technology, like a laptop with a webcam or tablet. So you'll find patients either joining from locations where they can get a stable Wi-Fi connection, which may not be at home. You'll notice that patients are joining from their phones. And so there may be some tips that you, as the person in charge of facilitating communication, should share. And we'll cover that more in our next section. Something else to keep in mind is that you may see multiple participants. This is something that often catches interpreters off guard. With the traditional VRI session, you are seeing the patient, but in a virtual visit, you can have a provider who is working with a colleague and maybe has the patient and a patient's family member at different locations. So you may very well enter an encounter or a session where you see multiple people on the call and multiple screens, right? What we ask is that you not be alarmed by this and that you handle the communication as you would any other encounter. And this is a perfect segue into our next section, which is going to cover sort of our professional introductions piece, okay? So one of the most frequent concerns I hear and complaints I get from providers is an interpreter entering a session and just sort of looking like a deer in headlights, right? So if you do enter a session and you have multiple participants and it doesn't look like your typical video session, don't allow the location, attire, or number of participants to affect your call readiness, right? First impressions really set the tone. So just as a best practice, you want to always join your encounters with your introductions, and we'll dive into what that looks like with the next slide. But immediately identify yourself as the interpreter. Provide your ID number and any other organizational greeting that your company has scripted for you, because sometimes we have interpreters just joining and either staying silent or joining and simply saying hello, right? So we want to make sure that we're maintaining that professional introduction. So what does that look like? For those of you who are on the call, especially being 94% interpreters in this webinar, we're assuming you all know the purpose and importance of professional introductions, but we want to just briefly review for those joining us who may not be interpreters and are learning to work with professional interpreters, and also those who just may benefit from a refresher, right? So professional introductions set the tone for the session. It clarifies who you are as the interpreter, and you have an opportunity to establish parameters and give some guidelines for the conversation. So the reason this is important is because this guides the provider and it also guides the patient, client, and any additional guest. Remember that in this shift to a digital landscape, We are working with providers who may not have relied heavily on virtual care in the past. And so it's really their first or one of their first times working not only with a professional interpreter, but doing so in a virtual world. And we also have patients that have never relied on technology to access healthcare or to use interpreter services. And so just keeping these things in mind helps us understand the importance of our professional introductions. So when we look at professional introductions, there are 4 main pieces that we want to start every call with. And again, when you join a session, you don't want to hesitate to start with these 4 points. You want to just join and cover these 4 points, which is thank you for calling. And if you are with an organization that has a different greeting, thank you for calling X company, you would include that. The next is my name is, my interpreter number is, and I'll be your Spanish or American Sign Language or Arabic or Russian interpreter today. The reason we're starting with these 4 key points, number 1, the initial greeting sets the tone. Number 2 is your name and interpreter number. When we look at what's required from healthcare venues across the country, we understand that they are required to document the use of an interpreter by federal, state, and local law. Another pain point that I hear from providers across the country is that an interpreter will go through their ID numbers so quickly that a provider is unable to capture. And so there are systems where the interpreter's ID number will display on the screen, but there are other systems that the interpreter ID does not display on the screen, or if you are taking the call as an over-the-phone interpreter, you need to be able to convey your interpreter number. So just keep in mind that while you want to keep your introduction brief, you want to make sure that you're speaking in a manner that is clear and that is at a pace that allows you to give the interpreter number in such a way that the provider can document that accordingly. The next couple bullet points here are just standard points that you would cover in any introduction. These are confidentiality, speaking in the first person, establishing a ground rule that one person speaks at a time, and communicating to the participants what your signal is for pausing. The reason this is very important is because you need to be able to manage the flow of the communication in these settings. And there is an extra challenge when you are doing so virtually, right? Because you aren't able to do a hand gesture or give a signal, a physical signal, as you would if you were in person. So establishing what that is early on and in your introduction is a great way to really ensure that if the provider or the patient hears this signal or sees this signal, they know to stop and pause so that you can accurately interpret. The next 3 bullet points are telehealth specific, okay? First one is that you can ensure that you can see participants or you should request repositioning. And what this means is that, again, with patients who are sort of diving into virtual care for the first time, they may not be aware or cognizant of how important it is to make sure that the device they're using, be it a phone, a tablet, or laptop, is positioned in a way where you can see them clearly. So make sure that you cover that in your introduction. The second thing is to explain any technical limitations. So as you're getting pulled into virtual visit calls, you may be working with providers who are used to interpreters placing outbound calls or adding a guest or pinning an interpreter or adjusting settings, volumes, and controls. You may not be able to do that with the telehealth platform specifically. And so it's just important for you to be able to set that expectation properly when you join the session, and best to cover that in your introduction. Lastly, you want to suggest that users are mindful of distractions. So again, we're thinking of, patients who maybe they need to tend to a child or they need a bio break, right? So just make sure that you can communicate that they should be muting their audio and pausing their video for these instances, as it can directly impact your ability to hear the communication and interpret accurately. You also may want to remind participants, and this goes for providers and patients, to make sure they're in a quiet space and near the best Wi-Fi possible. So as we discussed, many of these calls are being placed from home or public network. And it's important to note that any latency or connectivity issues can really be a result of that poor Wi-Fi connection on the end user side. So what you want to avoid is having the provider or patient frustrated with the interpreter because of connectivity issues. And one of the best ways to do that is just to set the tone and have them join from the best Wi-Fi area possible and in a quiet space. Managing the flow of the conversation. So here are a couple pointers that you as interpreters should be looking to use to be able to properly manage the flow of the conversation. The first is taking notes. With the ability to take notes, you would be able to avoid interrupting as much as possible. There are courses you can take, certainly at cross-cultural communications. There is a note-taking portion in the TCI training, and I'm sure they can offer additional training as well, in addition to other courses that exist out there. But make sure that if you are not well-versed in note-taking and it becomes more of a distraction to note-take than to interpret, that you rely more on frequent pauses. Okay, so take notes to avoid interpreting, but don't let it become a distraction for you in your accurate interpretation. The next piece is to instruct participants to speak or sign and avoid using the chat feature. So again, with these virtual platforms such as Zoom and Amwell, you'll notice that they have chat features similar to the one we're using now. And so what can happen is that either the provider or the patient can be communicating in the chat, and it's very difficult for the interpreter to not only handle and manage the flow of the conversation of what's being said or signed, and also have to tend to the chat feature. So just make sure that you are communicating that early on in the encounter. Next is to intervene and mediate to address communication barriers. And we want to keep in mind that, again, intervening and mediating is only as necessary. So a couple times here where you would want to intervene or mediate. First would be when people speak too fast, if several people are speaking at once, or if someone forgets to pause, right? So if someone forgets to pause and you have reached your max of the information that you are able to accurately retain and interpret, you'll want to intervene so that you can pause that speaker. There also tends to be a situation where, because there are maybe multiple participants, they forget some of the ground rules of your introduction. So it's absolutely okay to remind the participants that one speaker should be speaking at one time so that you can accurately interpret. When you intervene or mediate, be firm, be assertive, but be respectful. And remember that managing the flow of the conversation is really critical to accuracy. So accuracy is one of your ethical principles, and we'll talk a little bit about what those are next. But it's important that you are really taking control of that encounter and of that communication. Okay. Next, we'll look at code of ethics and standards of practice. So as it relates to the United States, the National Council on Interpreting in Healthcare, or the NCIHC, They published the National Code of Ethics for Interpreters in 2004. You can find this document that contains not only the ethical principles, but the standards of practice online. And the website is ncihc.org. Question to the group, and you may reply in the chat. How many ethical principles are there, and how many standards of practice are there? Okay, so we've got some answers here: 8, 6, 9, 9, 9. Okay, good. So we've got some very good answers here. And the answer is there are 9 ethical principles and there are 32 standards of practice. Okay, so this document is very important for you as an interpreter to become well-versed in. Ethics, standards, and white papers from the NCIHC have really shaped the profession of community and medical interpreting in the United States. And so adhering to this code of ethics establishes your role, and it's critical to the success of your encounters, telehealth and otherwise. Again, we want to remember that many providers and patients are accessing interpreter services virtually for the first time. They may be accessing the services from community hospitals that were relying heavily on ad hoc interpreters or family members, friends, and untrained bilingual staff. So it's that much more important to make sure that you, as the professional interpreter, are adhering to these ethics and standards of practice. This will help the providers and patients learn how to work with a professional interpreter. To that end, you'll see 2 graphics on the right-hand side. One is an eagle and one is a goose. And so I will also pose another question to the group. Those of you who are TCI trained may know this, but let's take a stab at it. What do you think the point is here in terms of the difference between these 2 birds and how that relates to interpreter services? You can reply in the chat. Okay. Teamwork, overview of perspectives, teamwork, flying alone, different languages. So lots of great answers here. Okay, the point of the graphic is that, you know, when you think of eagles, eagles fly alone, but geese fly in a flock. And so many times, especially now with the shift to virtual care, you want to think of your profession as a flock or a team, right? Every interpreter counts on everyone in the interpreting industry to advance our professionalism, our status, our recognition. But no interpreter can support the profession alone. So the more that we're able to work together, the stronger we will be. The shift to virtual care means an increased visibility for our profession. So it really is now more than ever important to ensure that we are unified, to ensure that we're providing the same level of service across the board, and to ensure that every time a provider connects with a professionally trained interpreter, they're having a seamless experience. That can happen if, as a group, we are following our code of ethics and standards of practice. So we will look at some tips and best practices next to wrap up the webinar session and leave some time for Q&A. And these tips and best practices will help us as well to make sure that these encounters run smoothly. As promised, there are interpreter recommendations and there are provider recommendations. So a couple things we'll talk about here: call readiness. So make sure that when you are taking a call, even more importantly with telehealth and virtual care, since again, they're being accessed from providers in many different locations. You want to be ready, camera ready. Have the camera positioned in a way where you are seen clearly with a good distance, right? So you don't want to be super close to the camera where all they can see is your nose and mouth. You want to sort of back up, and especially if you are doing American Sign Language interpreting, you want to make sure that your signing space or your signing area is clearly visible. Call readiness also means having your scripts ready. So again, we're thinking about those professional introductions. Thank you for calling. My name is, my interpreter ID number is, and I am your X interpreter today, right? So have a couple of your scripts ready. And the more that you start using these scripts, if you don't have them written down, the more that you'll be able to memorize them. Second is to use proper lighting and distance from the camera. So in terms of lighting, the best recommendation is always to either have 2 lamps on either side of your workstation. This reduces the shadows that can form behind you. You can also use a ring light, and that will accomplish the same goal there. Next is appropriate work attire and presentation. So make sure that you are appearing on the camera in clothes that are clean and ironed. Your presentation really speaks to your professionalism. And you know, we have heard and seen of situations where interpreters are either answering calls and they're in clothing that isn't business casual, or they're sort of taking a call and walking around the house with the laptop in their hand. So make sure that when you're taking calls, your presentation is what it should be, as it could affect the entire industry. Next is consistent or solid color background. So you want to make sure that you are working in an area either against a wall, or there are also some backgrounds that you can purchase for use for interpreting services. Your company or your organization that you're working for may have some standards and guidelines on what that color should be or what that background should look like. So you would defer to your company. But if you don't have that guideline, just make sure to make a small investment into a solid color background or work against a solid color wall. Please try to avoid being in front of a window where the window is your background, in other words, because it can really dim the way that you appear in camera, or on camera rather. Next is to speak in a friendly tone. And again, don't rush your introduction so that the team members can properly document. Also, never share PHI, personal health information, unnecessarily. So you may work with certain providers frequently. It's never a good idea when you're joining a session and you see a familiar provider to say, hey, are you still with patient Garcia, MRN number XYZ? Because they may not be with that patient. Even if you just placed a call with them, they may have shifted to another room. So please make sure that you're not sharing PHI necessarily, and this way we can remain HIPAA compliant. Next is to ensure that you can see the patient at all times. On the provider end, we want to make sure those providers on the line and also those who you'll communicate with after this webinar, you want to make sure that you allow the interpreter an opportunity for a proper introduction. Even covering all those points that we did in the introduction, it shouldn't take more than a minute to really establish the introduction, and even less, 20 seconds at most. The interpreter also may be unable to provide technical assistance, so we want to refrain from putting that responsibility on the interpreter. Next is being mindful of any background noise or distractions, as they could impede the interpreter's ability to accurately interpret. And lastly, we want to pause to allow the interpreter to accurately convey the message. Okay. Now we'll shift over to some tips and best practices from a technical standpoint. First is interpreter technical recommendations. What can happen sometimes on these virtual visits is that you may enter a session and you may not see someone right away. On occasion, an interpreter enters a session, they don't see any participants, and they leave, they disconnect. What happens is that some telehealth platforms require the provider to admit the interpreter into the room. So by the interpreter joining and disconnecting right away, you actually are placing the provider and the patient at a disadvantage because they may have just needed another minute or so to allow you to enter the room or admit you into the room. So just keep in mind, if you get a call and there's a black screen or you don't see participants, just stay on for a minute or so to determine if maybe it's a virtual health visit, okay? If the provider cannot see you or you cannot see the provider, sometimes you'll get this feedback. You want to make sure to try to turn your camera off and on. So toggling the off and on camera function on your end can sometimes refresh the video on a virtual visit, and then you would be visible to the provider. So if you ever hear that feedback, try that troubleshooting tip. Next is using a wired Ethernet internet connection instead of Wi-Fi. So for my interpreters on the webinar, it's always best to make sure that your connection is stable. Again, we're looking at latency and reducing connectivity issues. So the best is to make sure that your connection is via an Ethernet cable and you are really having the best connection possible. And along those lines, you want to close any unnecessary programs running in the background. Again, when we're looking at telehealth platforms and calls that are sometimes routed all the way in India and sort of come back to our country to get processed, that sort of distance of the call being processed and handled can add a lot of latency to that connection. And so we don't want to add and compound the issue by running unnecessary programs in the background. As it relates to the providers, again, we're looking at you admitting the interpreter right away. If your telehealth platform is a platform that once you add the interpreter, you need to admit them, please make sure you do that. Otherwise, the interpreter might prematurely disconnect if they don't see any other participants on the call. If you can't see the interpreter, please let them know. Again, there are some troubleshooting tips we just covered and others that they may be able to do if you can't see their video. Also, providers, it's important to recognize that if you experience long wait times for common languages, say you call into the Spanish queue, it may be an error if you're waiting for an extended amount of time, since it is a common language. So what we recommend is that you disconnect the interpreter and try calling back into the queue. And sometimes that refreshes that connection and you can get an interpreter faster. We hear sometimes providers saying, I waited 15, 20, 30 minutes for an interpreter to come on, and we don't typically see that long of a wait time. So if you're waiting more than 5 minutes, the recommendation is to disconnect the interpreter and try calling back into the queue.
Daniel,
Again,
sorry to interrupt, just to let you know, we have tons of questions and it is 15 minutes to the end. So just to let you know, they sound very eager to ask you questions.
Okay, excellent. These are the last 2 points and we'll wrap up. So for the provider, again, close any unnecessary programs running in the background and also ensure the patient can pin or spotlight the interpreter, especially for sign language, which you'll see on the right-hand side. Lastly, a quote from Martin Luther King, very fitting: of all the forms of inequality, injustice in health is the most shocking and inhumane. And so we want to be mindful of the importance of being equitable in healthcare. And with that, I will open up for Q&A.
Oh, perfect timing. Thank you so much. Yeah, I'm going to get started right away with the questions, Daniel, since there's so many. First one, do you find that providers normally let you get through the introduction? How do you deal with interruptions or comments like, I know I worked with interpreters before?
So I think It could be, if you're a newer interpreter, a little bit nerve-wracking to sort of hear that feedback. But again, we want to remember when we cover the professional introductions, the purpose and the importance of the introduction. And so keeping that in mind should give you the confidence to know, first of all, how that's going to help the flow of the conversation. And secondly, how that's going to positively impact your patient and the experience for the provider as well. So be confident. You are okay to push back and make sure that you get through the introduction. And typically, the more that they work with professional interpreters, the more they become accustomed to that practice.
Perfect. Thank you. Next, I work as a contract interpreter and do not have any ID number. What's the best way to handle that? Do I give the name? Do I give the name of the agency?
Great. So that's exactly what you would do, is defer to your agency's instructions. If you don't have a specific ID number, your name could be an identifier in addition to the agency you're working with. The provider will be able to document that information. And if there is any audit from an accrediting agency, they'll be able to pull and see that interpreter services were used and through what venue.
Very important indeed. Here are two very interrelated questions. One, can you provide a professional signal when speaking to ask for a pause? And two, Daniel mentioned establishing a signal to interrupt in order to manage the flow of communications. What are the best ways to gain attention, either by hand signal or verbal cue, without coming off as rude? Great questions.
Very great question. So again, when we think about intervening in a physical setting, we would use sort of a pen or a hand, but in a virtual setting that may or may not work. So don't be afraid to speak up. Excuse me, the interpreter needs to pause, right? Or doing a verbal pause of that nature would allow the communication to stop. And you don't need to be afraid to do that. You are managing the flow of communication for accuracy, which is one of the ethical principles, and to ensure that the message is being conveyed for both parties. So it is actually your responsibility to make sure that that happens. And one of the best ways to do so, if you need to, is by intervening. So don't be afraid to do so.
Thank you. With multiple people involved, have these other participants been advised about confidentiality for the patient?
That's a great question. So keep in mind that there are best practices and sort of things you'll cover in your introduction and ground rules that you'll establish. But really the responsibility of that communication and of that important confidentiality piece will come from the participants, be they healthcare providers or language service administrators or healthcare administrators that set up that session. So be sure to interpret, but you don't have to take on that responsibility and that additional role, as they would have likely covered that even prior to you joining the session.
Oh, excellent, thanks. Regarding setting the tone and introductions on VRI calls, what about noting that you will interpret everything that is said?
Yes, so great point. When we look at those pieces of the introduction that we covered, you make the introduction your own. So you want to make sure that you communicate, that everything will remain confidential, and that you will interpret everything said. If there are other pieces of your introduction that you like to include, certainly when I was interpreting, I used to say, so if you don't want anything interpreted, don't say it, because anything in an earshot will be interpreted. So any sort of flair or personal touch that you want to put onto your introduction, feel free to do so. We sort of just covered the really important pieces of what the introduction should contain, but you can add to it.
Excellent. I understand that you refer primarily to consecutive/liaison VRI. Is simultaneous used in medical interpreting at all?
So sometimes you can encounter a situation where you need to shift your mode of interpretation from consecutive into simultaneous. Sometimes this could be, a behavioral health situation If there are multiple people speaking at the same time or in a fast pace, you may switch into simultaneous. But the preferred method of communication is consecutive, and we may just need to remind the participants to speak one at a time and to give ample pauses so that you may interpret accurately.
Yeah, and I don't know how simultaneous would work on VRI. You'd have to have an RSI platform or an RSI workaround, right? So
Right.
when you really got to manage that situation, it's tough.
It's sort
In
of like you
healthcare.
sticking to whoever you hear,
Yeah, what can you
and you
do?
won't capture all of the information. So that's why we want to just gently remind of the consecutive interpretation and kind of kick that back in gear there.
Yeah, realistically. Um, my question, this is a longer question, so I'm actually going to summarize. The interpreter and the patient and family members and caretakers all were crammed into a very small room, 6 by 10 feet, in a community health center, which wasn't convenient for the patient or the family members or the interpreter. And the doctor was remote. And the interpreter is really upset about this and felt almost insulted because they're a doctor by vocation, the interpreter, and would never treat anybody like this, like their safety is below the doctors. So what is your take on this? The interpreter didn't say anything and didn't mind being at risk for the patient's sake, but the fact that the provider was doing this to the patient, is there anything, that the interpreter could have done or that you would have done? And at least nobody had any COVID symptoms or positive testing, but that is a really serious situation, isn't it? 6 by 10
Absolutely.
feet room. That's a small room
Absolutely.
for all those people.
Absolutely. Interpreting is really a social justice profession. And so I completely understand the feeling there of sometimes even feeling helpless in a situation like that, of wanting to be able to change the way that's being handled. The best thing that you can do is to make sure that, again, you recognize your role boundaries and what your role is in that session, which is to interpret. In the physical setting, sometimes in an office space or at an on-site interpretation, you have an opportunity to debrief with the provider. And that may be a good opportunity to sort of cover these topics. If you have an opportunity to do so virtually, if they stay around, you may want to just offer some suggestions there. But my recommendation is to handle the session professionally, make sure that you interpret accurately, and as difficult as that may be sometimes, because we would have handled the situation differently, remember that your handling of that encounter really speaks to all professional interpreters across the board. So it's important that we stick to our code of ethics and standards of practice.
Yeah, it's amazing how quite a few of these questions are really tackling the language access issue, which is a justice issue. This one, for example, Danielle says, I work at a busy public health system. If we ask providers to reposition their tablets or camera so we can see everyone, or even turn on the camera, we would never get anything done. Many don't even know how to operate the equipment. How do you suggest we change that? We have brainstormed at work without much success.
So I think when it comes to positioning, and certainly it's helpful in a virtual visit to be able to see the provider, but most importantly, you want to be able to see the patient, right? So if we're thinking about a virtual visit and we're thinking about repositioning, the instruction really is for the patient to be able to place their device in such a way that you can see them. The provider would be a plus, but again, as you mentioned, it's a difficult task. It takes education and continuing education and training. And so the more that we can chip away at that, both on your end at a local level, and certainly those of us in the VRI world handling calls on our end, the more we can, again, be united and unified in that communication and that training, we'll be able to progress in that area.
Thank you. And that sort of tags into a question like, how many providers in a call is too many? Some calls I've had 5 or 6, very hard to do. And you've just made clear it's really the patient that's the priority, not 5 or 6 providers. And this is actually a related question. visibility. To be able to see the other participants in the setting is always useful for the interpreter, but in order to avoid distractions, in some cases, it may be better for the interpreter not to be visible on the screen. So what are your related thoughts on this?
Could you share again? I'm sorry, I didn't quite catch that.
They're basically saying that maybe it's better for the interpreter not to be visible to avoid distractions, and your opinion on this.
I guess it would depend. You know, video interpretation, whether it's on a specific video device or it's a virtual visit, is really enhancing the provider and the patient experience. So most times they want to see the interpreter. If you have a particular situation where the instruction has been not to be visible, and that could be a situation where maybe there's a cultural reason why you shouldn't be on screen, go ahead and follow those instructions from the provider or the comfortability of the patient. But for the most part, I wouldn't make that decision on my own without consulting with the participants, mainly the provider.
Thank you so much. As we run out of time, I'm looking for final questions. What about the written forms to be explained or filled in on VRI?
So twofold, with virtual visits, there's this consent to telehealth in general, which we'll need to navigate that. But typically with forms, right, there is no proper way to be able to sight translate on a virtual visit, right? You don't have the document in front of you, and so you wouldn't be able to do that justice. And so we would want to communicate that to the provider, and maybe suggest an alternative mode, maybe someone on site who is able to sight translate, and someone who is able to, who has been trained for sight translation. So in the TCI training, we learn about the call model, and there's certain metrics that you need to make sure that you meet in order to be able to handle that that successfully. So I would refer you to CCC.
Yes, in case any of you are wondering, especially those of you from other countries, TCI training refers to the community interpreter, and Daniel himself has delivered that training. I want to close out by thanking Danielle. This is someone who has covered a vast arena: medical interpreting, educational, social services, legal, conference interpreting, voiceover. He's also been like regional client services manager for language companies, an interpreter trainer himself for more than 7 years. All kinds of education and training areas, including diversity, equity, and inclusion, and being the chair of a DEI committee and serving as a language services coordinator. I mean, he spans the spectrum. So we've really been, he's coming from many diverse areas of the field to distill that knowledge that he has just provided so generously to all of you. And we absolutely thank him for all of that. If you had a burning question that there was no time to answer, because we never do get to answer all of them, you can always email us at info@cultureandlanguage.net. We'll be happy to pass it on. And by the way, for those of you who've been here before, you know that usually I stay on to answer any questions about CCC or your certificates, or anything to do with our programs. Unfortunately, I have to leave on the dot myself now, but you will get an email in 24 hours roughly with a link to the recording, a link to the PowerPoint, and a link to your certificate. So look for that roughly 24 hours from now. And any other questions for us too, same thing, info@cultureandlanguage.net. Daniel, once again, thank you so much. We were lucky to have you, and we really appreciate it.
Absolutely. I'm so glad to be here. Thank you, Marjorie.
Thank you. Take care. Have a wonderful rest of your day.
You too. Bye.
Bye.